Hello, back again with another episode of Real Health Talk with Dr. Coring. My name is Dr. Coring, and for those who do not know me, I am an internal medicine physician, board certified, and also currently in training to be a hematologist and oncologist. And it's my passion essentially to provide education to common folks such as yourself regarding wellness. Yes, information and education essentially to advocate for wellness, to prevent sickness, to prevent illness, and also to show you guys how to maintain a level of health, a good quality level of health. And what I like to talk about today is cardiovascular health. Today I want to talk about heart disease and how we prevent heart disease, specifically atherosclerosis. And so, as we all know, or maybe we don't, but cardiovascular disease is the most common cause of death right now for adults. And right now, it's really, really important to understand how do we prevent atherosclerotic cardiovascular disease. What does that mean? It's a fancy way of saying how do we prevent artery blockage within the heart, so coronary artery blockage, to essentially prevent ischemic disease of the heart, meaning lack of blood flow to the heart. And we have vasculature within our heart called coronary arteries. These arteries are susceptible to plaque. This plaque can cause plaque rupture within the vasculature or the coronary arteries and essentially cause blockage, blood flow blockage to the heart itself, and essentially that causes a myocardial infarction, also known as a heart attack. And what that can cause is death. All right? Yes, so myocardial infarction because of coronary artery blockage, because of plaque in those coronary arteries, because of atherosclerotic disease, essentially that leads to death. Cardiovascular injury, severe injury, where it can essentially lead to death, and we want to prevent that. And the way we prevent atherosclerotic disease is with primary prevention. And today I want to talk about medicinal primary prevention to prevent atherosclerosis. Okay, and so what are the risk factors? Let's talk about that. What are the risk factors for atherosclerosis? But before we talk about the risk factors, let me just explain what is atherosclerosis. Atherosclerosis is a big term essentially to suggest that there is plaque or fatty deposits inside of the arteries, the vasculature. And this could not only mean the arteries that innervates or essentially feed or perfuse the heart. It's arteries that perfuse the brain, the kidneys, as well as other organs, major organs of the body. And so we could have atherosclerosis among the cardiac arteries, or along the arteries that perfuse the brain, as well as the kidneys. And when we have blockages in these areas, and also, I'm sorry, the limbs, the extremities as well. And so blockages, because of built up fatty deposits and or plaque, can cause ischemia to these organs. So the heart can be injured because of atherosclerotic disease. The brain can be injured in the form of a stroke, an ischemic stroke, because of plaque buildup in these arteries. The kidneys can be injured because of this plaque that's building up, and also the limbs. We can have something called peripheral artery disease. These arteries that innervates our legs, our arms, can also have blockages because of this plaque buildup, and that can cause ischemic injury to our legs as well. And so we want to prevent the plaque from building up or prevent atherosclerotic disease. So atherosclerosis is basically a buildup of plaque within the arteries, and we want to prevent this from happening. And so before I talk about prevention, let's talk about the risk factors. What put you at risk for having this plaque to build up in your arteries called atherosclerosis? Well, one of the first risk factors is high blood pressure. if the pressure is continued to be high and elevated within the arteries or the vasculature, then that pressure causes irritation to the blood vessels itself. That irritation within these blood vessels can cause tearing of the blood vessels itself, and that tearing can essentially cause plaque to build up along the healing process to heal that tearing. It's going to involve plaque. And once this plaque begins to develop, the plaque has potential to rupture. And it's the rupturing of the plaque that causes essentially blockage or occlusion. And it's the blockages that essentially cause disease, such as infarctions. We can infarct the heart, the brain, the kidneys, the limbs. And so we want to prevent infarction. So high blood pressure. The pressure buildup can cause tearing. That tearing can cause plaque to start to form. That plaque can build, cause rupturing. It's the rupturing of the plaque that really causes acute problems. Chronic problems will arise as long as the plaque continues to build. Then you can have chronic lack of blood flow. We call that chronic ischemia. Okay, another risk factor is smoking. Smoking can irritate the blood vessels itself and cause the same process. It's the irritation and the tearing of the vasculature, which causes the plaque to start to form. And so smoking is a risk factor. Outside of high blood pressure and smoking, diabetes is a major risk factor for atherosclerotic disease. Essentially, it's the blood sugar in the vessels and the vasculature that causes the irritation and sets off the cascade, just like smoking, just like hypertension. This cascade involves tearing of the vasculature. This tearing opens up the vasculature and exposes the vasculature to plaque buildup. The plaque starts to build up and can cause problems such as blockage. All right. So outside of that, then outside of smoking, outside of diabetes, outside of high blood pressure, high cholesterol itself. So if your cholesterol is elevated, the cholesterol then builds up into the arteries, and then it's the cholesterol itself that starts to build up and form these plaques, and then the plaque rupture causes the cascade that I talked about previously. So high cholesterol itself can cause problems and also lead to atherosclerotic disease. Obesity is another risk factor. It's the obesity that essentially can cause a sedentary lifestyle, so the blood flow is not circulating just because sedentary lifestyle, and also obesity can cause elevated LDL or bad cholesterol and low HDL or the good cholesterol. Essentially will lead to high cholesterol, and it's a high cholesterol that builds up into the arteries that can cause atherosclerosis. So these are the risk factors. What do we do about these? How can we prevent disease? Well, the first thing, obviously, is to manage or modify these risk factors. So if you have high blood pressure, let's get our blood pressure under control to reduce the irritation of the vasculature. If you're a smoker, let's stop smoking to reduce the irritation of the vasculature. If you're a diabetic, let's get our A1C under control. Let's get our diabetes under control. Let's get our blood sugar under control to reduce the irritation of the vasculature. If you're obese, let's start losing some weight, all right, to reduce our cholesterol in order to prevent the cholesterol building up in the arteries within itself. If you have high cholesterol, let's control our diet to reduce the cholesterol. Okay, let's take the medication to reduce the cholesterol, all right, to prevent the plaque building up into the arteries. Okay, and how can we prevent this medically? This is called primary prevention. Okay, and so what will happen is your physician, mainly a primary care physician, will assess your risk for having what we call an atherosclerotic cardiovascular event, or essentially a event or what we call a cardiovascular event, meaning that injury to your heart because of this problem, because of built plaque in your arteries. What is the risk for you to have injury to your artery because of this problem? We calculate that risk by assessing your blood pressure, by assessing your smoking status, by assessing how well your diabetes is controlled, by looking at your cholesterol panel, seeing how well your cholesterol is controlled. Also taking your age and your gender into consideration. We come up with a score. If that score is high enough, we will recommend starting you on medication to reduce the plaque buildup, to reduce the cholesterol, essentially, to reduce the inflammation that could be going on within your vasculature. This medication is called statin therapy. So, based on your scores, based on your risk factors, we will recommend a statin therapy. And also, based on how high or low your risk factor is, we will recommend either a high dose, medium dose, or low dose statin therapy. And so, what that means is, that we need to understand how well your blood pressure is controlled. So, taking a good log of your blood pressure is important. Also, having a cholesterol panel on file. If you haven't seen your primary care physician and you're over the age of 40, let's get your cholesterol level assessed. Also, if you're smoking, stop that. If you're a diabetic, we need to know your A1C. So, allowing us to understand how well controlled your diabetes is going to be very important when we assess your risk. And then we'll make a determination based on your score if you should be on a statin therapy, essentially to prevent a myocardial infarction, injury to your heart because of atherosclerosis. Also, this helps prevent stroke, kidney disease, limb or lower extremity disease as well. And so all of this information is important. And so what I'm encouraging you guys to is to follow up with your primary care physician to understand your risk of developing a cardiovascular event, mainly ischemia or myocardial injury because of atherosclerosis. The next medication that we can take to help prevent these cardiovascular events is aspirin. Low dose aspirin, 81 milligram aspirin, can also help prevent a cardiovascular myocardial infarction if you have certain risk factors. And I went over these risk factors. And so your primary care physician should assess your risk factors to see if you qualify. Everybody does not qualify to take aspirin, especially if you have a history of bleeding, because the medication aspirin can put you at risk for bleeding. And so please talk to your primary care provider or your physician to have you to be assessed for your eligibility to take either aspirin and or statin therapy. All right. So just to recap, atherosclerosis is bad. It's plaque that's building up in your arteries and can cause bad things to happen to you, primarily cardiovascular disease in the form of myocardial infarction. It also can cause stroke, essentially because a plaque is occluding the arteries in your brain. It can also cause kidney damage because a plaque is occluding the arteries to your kidneys. It can cause leg ischemia, called peripheral artery disease. It can cause aneurysms, abdominal aortic aneurysms, because the plaque is building up in the vasculature and the abdomen. It could cause problems when this plaque starts to build up. So what do? We control the risk factors. What are the risk factors? High blood pressure, smoking, diabetes, obesity, high cholesterol, sedentary lifestyle. We control these risk factors by stopping smoking, by controlling our high blood pressure, controlling our diabetes, better diets, controlling our cholesterol, activity, physical activity, and also we can use medications to prevent bad things from happening to us if we qualify for the medications. Medications such as statin therapies to reduce the cholesterol and inflammation inside the vasculature, as well as aspirin, if you qualify for it. All said, please, heart disease is the number one cause of death. Please, if we can modify the risk factors, please take heed to what I'm saying regarding modifying the risk factors. And if you're eligible for medication to reduce this risk from happening to you, talk to your primary care physician to be assessed. That's my time, guys. I love you guys. Peace.